we are seeing figures for deaths that involve COVID that are 15% higher than NHS England's latest reconciled data. Now, what they do is they take the daily figures that are announced on the news every day, and they update every day based on when the death actually occurred. So we're 15% above NHS England's latest figure for the same time period, and we're 50% above the figure that was actually announced at that time. Now, that's perfectly understandable because there are lags in the reporting of those deaths from hospitals. So, I mean, setting this in context, the latest week's deaths figures that we put out are the highest number of deaths in any week since the start of this century. 21% of those deaths involved COVID, 47% in London. Now, 10% of those deaths took place outside of a hospital setting. Now, 5% took place actually, or we've been able to link to a care home setting. Now, that's an important thing to understand, and we've been looking at that in some detail. So the week before, we had 20 deaths that were in a care home setting. This week, we've got over 200 deaths that are in a care home setting. So there's an order of magnitude difference, and it gives you it's only 2 data points, and you can't get too heads up on 2 data points, but it gives you an idea about the direction of travel and the scale of increase in those deaths that are taking place in care home settings. So I don't know what the figures will be next week, but that's the trajectory that they're on, which would tie up to some of the latest reports we've seen in the press from care homes. What we also don't know at the moment is, on average, it takes 5 days between a death actually occurring and that death being registered. Now, it could well be, in current circumstances, that there are different delays on deaths that are happening in different settings. So again, we need to see more data to get a feel for, are there greater delays in death registrations for these deaths that are occurring in care home settings?